welcome everyone. We're so excited to have you all on. It's been an interesting couple of weeks to say the least, right? Um,
Yeah.
we were very excited to get things rolling 2 weeks ago with the program. And so before, I say anything else, I want to thank you all. You all have been so incredibly flexible and positive and really responsive, responding to calls and text messages and emails. Programs of this sort are always a complex thing, and so the fact that you guys have been so easy to work with has really helped things, especially coming into this first week. So I'm excited. I'm thankful for you guys taking time to be on this call. I know a good percentage of you were affected by the recent ice storms. And so it means a lot that you guys took the time to be on. And so for those of you who were affected, I hope things are going better for you. Um, some of you, 2 weeks without power. And so I can't imagine that must have been incredibly difficult. So we're just thankful. We're thankful you're taking the time. And so we're just excited. We're excited. Um, to get things rolling, I would ask of you, if you haven't already, to make sure that we're getting a good understanding of who's on with us. If you could please change your name to on the call, that way we know who you are. And if you're in a place where you can have your camera up, we'd love to be able to see your faces. Ideally, we wanted to be able to do things in person, but we can't. And so to help us connect with you and to really try to create as much of a connection as we can. We'd love for you to turn your camera on if you're in a place where you can. If you can't, if you're multitasking, we totally understand that too. So that being said, I just want to give you guys a real brief overview. I know in my calls and emails, I know it seems like some of you I've talked to so many times over the past couple of weeks. You're probably well versed in my phone number as it pops up on your phone. This is the On the Road to Health program. And this program is a partnership between the Ardmore Institute of Health and many partners here in Oklahoma City, Centennial Health, Integris, OXU Extension Office, and many more partners that have come together to create an opportunity for folks in Northeast Oklahoma City, women specifically between the ages of 25 and in some cases 60, and so 60 plus. And so we are delighted to be able to come together and to offer resources that are going to engage you to look at your health differently, or maybe give you some of the tools and resources needed to be able to get healthy, or to do what you need to do on a personal level to get yourself, as far as your health is concerned, in the right direction. So we're excited. As I've told you, this is a 12-week program broken into now what will be a 4-week section and then an 8-week section. Obviously, the loss of the past 2 weeks has us still moving forward over the past 4 weeks, and then we'll go into the new year, extending a couple of weeks. And so uh, things should look good. Things as we go forward are going to continue to unravel, and you'll get to learn a ton. And so we're excited to give you a few expectations. Every Tuesday night at 5:30 at the same time, we'll be joining in the same fashion. We'll hop on Zoom, we'll talk, and we'll be able to talk about the curriculum as it relates to the book that you all received last Wednesday. And our instructors, who you guys will meet here in a second, will do a fantastic job of leading you through that and guiding you through those resources, and be able to walk through you in this process. One thing I really want to lead with is, this is to be a conversation. This is to be an opportunity for us to engage with one another. So please ask questions. If you have follow-up after the call, you're going to have the ability to continue to contact me and get in touch with our instructors. We want this to be much more than a lecture. We want this to be a conversation and an opportunity for you to get questions answered, and to point you in the right direction towards resources. So we want to be as comprehensive as we can with this. And so when I tell you, please ask questions and please be as engaged as you possibly can, we love that. And so outside of meeting on Tuesdays, similar to how you all were able to engage with us last week, on Wednesday at 3 o'clock. Going forward, we'll be meeting at Metro Tech to get the resource kit in your hands. So tomorrow, no, I'll say it now and I'll say it again at the end of the course. Please make plans to meet me at Metro Tech at the same spot at the STEM building to go through the drive and get the resource kit for this week. And so, thank you guys so much. We're excited. What I'd love to do now is to take a couple of moments to introduce you to the fantastic group of instructors that we have. And, I want to take a second to tell you that these folks that you're going to have the opportunity to work with are experts in their field. People that have taken the time out of their week and out of their work to engage with you. And so note that you really are getting able to get this information from some of the brightest minds that we have here in the city. So I say that so you know that if you have questions, if we don't have the exact answer, this group of folks can get us pointed in the right direction if they aren't themselves equipped to answer it. So with that being said, I'd love to take a second and introduce them. From Centennial Health, we have two partners with us. We have Dr. Charles Lynn and Brianna McGinnis with Centennial Health here with us, and they're going to talk to you here in a couple of minutes. We also have Taylor Connor, who's a dietitian with Oklahoma State University Extension Office here in Oklahoma City. Taylor, you might have missed it. Did you wave your hand? I think you did, and I just missed it. We also have Valerie McMurray. She may not be on at the moment. She will be on here in a little bit to be able to introduce herself to you all. Then we also have Leandra Moore. Leandra, are you on here? I think I saw your name a couple minutes ago. If Leandra isn't at the moment, you'll get to meet Leandra here in a second. And then I skipped Pam. We also have Pam Patty, who's a dietitian as well. And so these folks really have taken a lot of time to work on this program and really put together a curriculum that they think is going to engage you and give you not just information, but equip you with the resources you need to get moving in a good direction. And so I said it once, but I'll say it again. Please engage them. Please ask questions, and please take this as an opportunity to better equip yourself. I know that I'll be using the information personally to do what I can to apply it. So we're thankful for that. Without hesitating any longer, what I would love to do is to really kind of get this thing rolling and to kick things off. And so with that being said, Dr. Charles Lynn and Brianna, they're on the call with us to talk about some health information as it relates to basic understandings as the things, how they might apply to our lives. And so they're going to take some time here with us to talk about concepts such as diabetes, cardiovascular disease, hypertension, stress and anxiety, and to give you a good understanding as to how those things could play a role in your life, and give you good information so that way whenever we talk about this course, the information you'll be hearing, you'll have a good foundation as to how those concepts and bits of information apply. So Dr. Charles Lynn, Brianna, if you guys are oh, yep, there you are. If you guys are ready, I'd love to give you guys the floor to talk about some of those bits of information.
Okay, thank you very much, Anthony. Can you hear me? Does everybody hear me? Good, I hope. I pressed unmute. So I'm Dr. Charles Lynn. I'm with Centennial Health. I've been practicing family medicine and adult medicine for about 30 years. First off, chronic illnesses, just briefly, those are diabetes, high blood pressure, high cholesterol. I used to teach medical students, and they would always ask me, why do you see chronic illnesses? And one of the reasons you have chronic illnesses is that you're chronically alive. When I was in medical school, we never studied about anybody above age 75. Now, not a week goes by when I don't see 2 to 3 to 5 90-year-olds. With that said, I'd like to introduce Brianna McGinnis. I've been working alongside her for several years. And she is a great nurse practitioner and a primary care provider. And she wanted to talk to you briefly about diabetes. I'll talk to you about a few other things, but I'm going to let Brianna take it from here.
Thanks, Dr. Lynn. I'm Brianna McGinnis, and I am a nurse practitioner at Centennial Health, and I've been practicing in family practice for about 5 years. And so we just kind of wanted to touch base on a few things today. First off, that we're going to talk about is diabetes, and I'm sure just about everybody knows someone who has diabetes. They themselves have diabetes or knows a family member that's been affected by that. It's very prevalent in America in general. And I know that Taylor and Pam are going to talk a lot about specific things when it comes to diet and stuff like that later on, which we know does play a big role. But I wanted to touch base with you guys about diabetes itself. I think a lot of people don't understand how diabetes develops and how it affects our bodies and that sort of thing. And so I'm going to touch base on those things. And then, like I said, Taylor and Pam will go more into diet and things that we can do more specifically to help with those things in the future. So when we think about specifically type 2 diabetes, type 1 diabetes is a completely separate thing that we're kind of born with and those sorts of things. It's an autoimmune thing. And so we're not going to talk so much about that today as we are type 2 diabetes. Type 2 diabetes is something that we develop over time. And so typically we see the diagnosis of that sometime after the age of 30 or later. Sometimes it's earlier, and a lot of it depends on our lifestyle and how well we take care of ourselves as far as diet and exercise and those things are concerned. So we think about diabetes itself, it develops when the burden on our body to create insulin is greater than what we create. So the pancreas, which is an organ in our abdomen, that is in charge of creating insulin for our body. So we eat and our body starts to break that down, and we have to neutralize that sugar in our body. So when our pancreas is feeling overwhelmed and it's not able to keep up with that demand, some of those pancreatic cells just get tired and say, I'm not going to do this anymore. I'm not going to continue to make insulin, and I'm done. And they kind of just walk off the job. And so slowly over time, we lose some of that ability to create our own insulin, and that's raising our blood sugar. So when I know that for many of us, we know that that our liver and other organs can kind of regenerate ourselves, but unfortunately our pancreas doesn't have that ability. So once those cells stop working for us, they're kind of done. And then we have to look at other ways to lower that blood sugar. So we think about prevention of diabetes, a lot of that goes into lowering how much insulin our body needs. And we do that by watching our diet, lowering the sugar that we eat, looking at carbohydrates and those sorts of things. And again, I think Taylor and Pam are going to kind of look at the breakdown of foods and stuff like that a little bit later. But when we think about if we can do that prior to getting to the point of needing medications and stuff like that, if we can reduce that, then it can help to prevent diabetes in our system. The other thing that I wanted to touch on is the kind of the long-term effects of diabetes on our bodies. I know that a lot of that is unknown unless you've had somebody, a family member or someone that you've been close to. So when our blood sugar is too high, that affects all of our vessels. And so it affects, our circulation to our feet, and we worry about ulcers and things like that. It affects our blood flow to our eyes and our heart and those sorts of things. And so our risks when we have diabetes of blindness and other complications, of kidney problems and heart disease and things like that go up. And so it's something that's important for us to try to focus on or to control if we already have diabetes, to control effectively so that we can lower the risks of those complications. I think at this point, Dr. Lynn is going to talk a little bit about cardiovascular disease and stroke and things like that.
Yeah, thank you, Brianna. That was great. I think I got the more fun part of this thing, uh, which is more of what I do all day long. Just briefly, uh, cardiovascular disease, heart disease, hypertension, dyslipidemia, cholesterol, they all go into the same kind of pot. So I'm going to talk to them, kind of intermingling them. One of the reasons it's very important is because women get misdiagnosed an awful lot. I've seen it plenty of times when women have come in with what we thought was indigestion or some other thing, and did not get appropriate treatment. In fact, one time, the World Health Organization, no, CDC, looked at Lawton, Oklahoma, because of the highest rate of cardiovascular disease and death in African American women in the world. So it's very important that we understand risk factors in cardiovascular disease, and so we can try and prevent that. Now, I'm just going to briefly talk about hypertension. Hypertension is very common. It means your blood pressure is greater than 140 on the top, but lower than 90, above 90 on the bottom. That's what we call the systolic. The risk factors for hypertension are age, ethnicity, family history, obesity, all the things that everybody knows about. So that seems really complicated. So I'm going to get it very personal to you. Me. So I come from a family that's high risk. In my family, I am the slimmest member by far. Everybody in my family has hypertension. Most of them have diabetes. I personally developed hypertension about 3 years ago. Surprisingly, I found out after I ran a marathon. Even if you're exercising, doing the right things, you can develop these chronic illnesses. That doesn't mean you did anything wrong. It just means that's part of life. In my family, I'm the oldest of the three boys. My brothers had been on hypertensive medicines 10 years prior to me. So my running and exercising did help that. One thing, and just, people get confused on when you should check your blood pressure. I have people get these blood pressure cuffs and they're checking their blood pressures every day, 3 times a day or something like that. The reality is, the layperson can't do much about their blood pressure. So you really need to try to see some sort of medical provider, somebody like myself or Brianna, to check your blood pressure. Generally, you want to start getting your blood pressure checked at age 20. Most people should get their blood pressure checked every 2 to 3 years up until age 40. Then at 40, I pretty much recommend every year for the rest of your life. Some of the remedies for elevated blood pressure is weight loss, exercise, decreasing the salt in your diet. A lot of people like vinegar and garlic and several other remedies. Unfortunately for me, I don't see those things work. Obviously, if they work, people wouldn't come in to see me. So that's the hypertension part of it. When you get hypertension, it does lead to lots of bad things: heart attacks, strokes, blindness, all those things that with finishing this program is going to help you prevent a lot of those things. The second thing I wanted to speak briefly about is dyslipidemia, or high cholesterol. Cholesterol is normal. Some people, again, the same risk factors: genetics, ethnicity, and age. I have patients who weigh 100 pounds and have extremely high cholesterols and triglycerides. Then I have 400-pound patients who don't have cholesterol. So there is some genetic component to that. To treat that, mostly diet and exercise is the key to treating and reversing that. However, at some point, some people need some medications, and the medications are actually quite amazing now. So I gave you the fast one, but I really want you to feel like this program is going to help you prevent seeing somebody like me and me writing you a whole bunch of prescriptions. With that said, I want to give it back to Brianna to talk about stress, which I feel augments or exacerbates anything else we're talking about.
Okay, so one thing that I just, wanted to add to what Dr. Lund said, I agree. I think, so much of this program is really trying to help prevent you from needing medications from us. We don't, contrary to what I've heard in the past, we don't like to write for these medications. If we can control them outside of medication, we would much rather help you guys figure out how to do that within your lifestyle. So I am going to just touch briefly on stress and anxiety. And I know we all have a good idea of what this looks like in our lives. It's 2020. So who isn't stressed and have some anxiety at this point? I think some people have dealt with more anxiety in their lives. And I think certainly this year has kind of just made all of that more than what it normally is for most of us. So the thing about it is exactly what Dr. Lund said. Stress and anxiety that we don't know how to cope with and that we don't have resources to help with will absolutely exacerbate all of these conditions that we're talking about. So typically when we see people who have a lot of stress and anxiety and they don't know how to use those coping strategies or aren't sure how to deal with it, we tend to eat not as well as we should. We tend not to exercise. We tend to kind of come within ourselves. And so it's important that we use the resources. And I know that there are some great helpers on here later today to talk about resources that are available close to us to help, figure out how to manage your stress and anxiety in your life, because it's just so important that we look at those things. When we have uncontrolled stress, a lot of times our blood pressure goes up in response to that, and excuse me, sorry, it flashed something up there and I was trying to figure out what that said. And then of course, we, like I touched on earlier, we just tend not to eat as well. We tend to go into a comfort food kind of place and that sort of thing. And so I think, again, that the other providers that are on here are going to help us realize how to deal with those things and what other resources are available so that we can control those. Certainly, as Dr. Lynn said before, we are always here to help with those things too, and certainly can help, get you to other resources, or if medication is needed because we're at that point, then those are things that we can definitely discuss with people. Okay, Anthony, I think I'm giving it back to you.
Yeah, thank you guys so much. What I would like to do is, ask the participants. I know, a lot of really good information, but do you guys have any questions? Because the reason why I say that is these two folks are they're experts. They have the ability to really point you in the right direction. So I'd really encourage you, if you do have questions, please ask them. Right. There's no copay required, right? If you got any questions, I'd really love for you to be able to take the time while we have them on the line to be able to get any information. If you don't, that's okay. I'm always going to be looking to find ways to get your questions answered if you send them to me, say after a call. So whether it's right now or in between sessions or throughout the week, as it relates to your physical health, your mental health, anything of the sort, please send me those questions, send me that information, and I'll do my very best to connect you. I'll connect you to the resource that I best can. Yeah, great question from Greg Jones, who is the Director of Outreach at Centennial. So Brianna or Dr. Lund, my question to you, or this question from Greg, is why is it so important to have a primary care physician?
I'll take that one, Brianna. So primary care physicians, basically, I look at myself as a translator. People come to me and I translate what their illness are. I do the first assessment before I have you see another specialist. When you see the specialist, a lot of times I'm translating what the specialist said and then making it work for you as a primary care doctor. Like a specialist, when you see a heart doctor, he or she only has one goal: fix the heart. They don't necessarily care that your legs hurt from the medications or that you swell. but I will, and I do. We are really good about prevention of ailments. It's in our best interest because we don't like people going to the hospital or harming themselves. Brianna, do you have anything to add to that?
I don't think so. I think you answered it. I think what Dr. Len said is true. A lot of times, there are things that we can help prevent before you need a specialist. There's a lot of screening tools that are available to us in the United States as far as catching, different illnesses and chronic illnesses and those sorts of things early. And so that's where it's important for you to stay plugged in with someone so that we can help to prevent those things and then help to just get you to a healthier place.
I unintentionally hit my mute button, so I couldn't unmute myself. But yes, thank you for that. I want to let you know, Monica, I saw your question. What I would really like to do as far as the diet piece, Monica asked recommendations for a diet for high cholesterol. What I would like to do is to hold off on that question, so that way whenever we get to some more of the diet components, allow Taylor and Pam to be able to really kind of go through that piece in a more detailed way. And so we're going to get to that. We're going to get to that one, Monica. Another question that Dana had asked was, can someone ever stop taking blood pressure medication?
Oh, sorry, I couldn't unmute myself.
I could not.
Same.
I was pushing buttons. Brandon, you want to take that one?
Sure, I can take it. Is it just part of getting old? And I think the answer to those questions is yes and no and both. Yes, we have people who are able to get off of blood pressure medications at times. As Dr. Len said earlier, there's things to do to prevent hypertension, and there's things that we can do to decrease that. And part of that is exercise and weight loss and reducing salt in your diet. Those sorts of things can help with the blood pressure. And so there are times that we do see people able to make those lifestyle changes and then get off of medication. But as Dr. Len said earlier, there's times it's just what your parents gave you. There are times that people are in excellent shape and they have the best diet and they run marathons and they're still on blood pressure medication because that's just genetically what they were given. So I think the answer to that is sometimes, yes, we actually do see some people be able to get off of them, but it's not something that we can always do.
And that's a great answer, Brianna. One thing I would like to add, a lot of my patients, when I give them a medicine, they say, what is the side effect? Now, we have this impression that there's always bad side effects. In hypertensive medicine or blood pressure medicines, a lot of them actually have good side effects. Some blood pressure medicines protect your kidneys. Some blood pressure medicines stop headaches, menopausal symptoms. So sometimes we use blood pressure medicines and several other medicines, what are called off-label uses, that actually help you. So yeah, a lot of people some people can get off blood pressure pills. I'm really trying to get off mine, but it's not working. So take the pill.
Yeah, thank you. I think we had one other question. Oh, yeah, she did address it. Yeah, well, great questions. I appreciate Dr. Lund. Brianna, were you adding something? Oh, I don't think she's talking to me.
Sorry, I made an emoji on my thing somehow. I don't know. I was trying to figure out what I was pushing. I don't know. It's fine.
Oh, that's funny. Well, I want to thank the two of you so much for taking time. I'd love for you guys to be on the call and attend with us. If you've got prior commitments or things that you need to attend to, I completely understand. But we really appreciate you guys, and we look forward to continuing to work with you all. I want to let you guys know, if you don't have a primary care physician or for that matter, or need to connect with one, I know that at our health screenings that we do, we'll offer you or connect you with resources. And one of those resources we'd also like to make sure that you're aware about is Centennial Health. Centennial Health is located on 23rd Street. Greg, if you're still on the call, if you could put the address for Centennial Health in the chat, if you could refer to the chat and see that, we'd love to connect you with them. So if you're looking for a primary care physician, we'd love to connect you with their resources. Also note that at all of our health screenings, when we're collecting your information to build your health profile, if you ever need a resource for your health, and one thing we always do with our partners at Integris who have been working with us and getting those screenings done is we offer or try to connect you with free resources that exist as well. So Dr. Lund, Brianna, thank you guys so much. And we hope you guys have a great week.
Thank you for inviting us. I'm going to skip out because my daughter needs a cookie, apparently. Thank you.
I agree. Thank you so much for having us. I've got one that I've got to get to ballet class. So thank you very much. Appreciate it.
Completely understand. Thank you guys.
Thank you.
The next instructor who I know you guys were just able to see and meet, but I'm excited to let you guys hear from her for the first time, is Taylor Connor. Taylor is going to talk to us, give us an introduction to nutrition.
All righty. Well, good evening, guys. Thank you so much for taking the time. I'll make sure you guys can hear me okay on this. Okay. Can you hear me okay, Anthony? Okay. Well, I first wanted to ask, did anybody make the chili or did they try the chili? Raise your hand. Yeah? Yeah? Okay. What do you guys think? Thumbs up or thumbs up? Okay. I thought it was pretty darn good. I actually mixed it with some Greek yogurt, so it made it a little bit creamier too. All right, good. I'm glad you guys tried it. I hope you really take advantage of the meals or the recipes in the food that we'll be providing you, and that you take the opportunity to make those meals. Of course, sometimes things happen and we can't, but as mentioned, my name is Taylor and I work with OSU Extension, and I will be one of the 2 instructors and dietitians throughout this program. So you'll hear a lot from me, unfortunately. Hopefully not, but just kidding. But so anyway, tonight it's going to be kind of brief. We're just getting introduced to this topic, and what Pam and I will be hitting on is the nutrition part. And so what I want you guys to do right now is go ahead and grab your binders. Hopefully you're in a place where you can lay it out. It's get your pens ready, your pencils ready to take notes if you're a note taker. And then we'll kind of just work through this. So Pam and I are going to split this lesson tonight. So hopefully you'll get a mix of both of us and kind of get a feel for it. So what I want you guys to think about throughout this On the Road to Health. So just think about On the Road to Health, and what do you think about? You typically on the road, we're on a journey. And so that's what I want you guys to think about with this program. I want you to think about your health and your health goals, whether that's managing your diabetes better, your A1C, lowering some lab values. Maybe your cholesterol is really high. I saw that question up there. Or maybe it's to lose weight. Maybe that's your goal, just to lose weight. And your research does show when we lose weight, we actually manage our diabetes better and our numbers and those sorts of things. So maybe it's just weight loss. Whatever it is, I want you guys to think of it as that journey. And with any kind of journey, so I want you right now to think about a vacation, a journey you've taken in the past that you've enjoyed, hopefully enjoyed. And with this journey, thinking about it, I want you to think about the steps it took to get there. If it's a vacation, maybe you went out of the country, maybe you just went to a different state and you didn't just appear there. It took steps. You had to plan it out. Maybe you had to save up money. You had to prepare for it. You had to pack, get in the car and go, or get in the plane, wherever you need to go. And just like that journey, we're going to walk through these steps with you tonight. And so what I want you to do is to go ahead and turn to page 4 in your binder. So go ahead and open it up. You'll see a page of a really upset girl, and because we're talking about diets, because I'm sure that's how a lot of you guys probably feel about nutrition or about diets, because you've probably been burned in the past, and that's a very common thing. So don't feel bad. And I don't want you guys to think of it as just another diet. I don't want you guys to think of it like that. I want you to think of it as that journey that's going to be step by step. And so I'll go ahead and ask the question. Have any of you guys, and you don't have to answer. I want to make this as interactive as possible because Zoom is just always so limited. So I'm going to ask questions. You can raise your hand. You can react with the emojis, those little crazy buttons on the bottom. Or if you want to type a question or just response in the chat box, feel free to use that. And I'll kind of play back and forth to make sure I'm including everybody and acknowledging you guys because I like the interaction. So has anybody ever been, thumbs up, okay, good. You tested it out. It's fine if you want to test it out. So have any of you guys ever been on a diet? Or tried to? Yeah. And how did you feel about it? It was probably ups and downs, right? So for most people, yeah, a big fail. Yeah, yep. And that's like I said, for most people, most of the time, diets simply don't work. Not long term at least. So you may have done a diet in the past where you lost weight, great success, and then what happens? We go back. Okay, so what I want this program to bring to you is this idea of a change in habit. And just like with any habits happen over time. You're not going to lose 5 pounds in 1 week. I'm sorry if you're here for that, then it's just not going to work like that. It takes time if weight loss is your goal. If you're changing a number, you want to change your cholesterol number, it's going to take time. And a big aspect of changing those numbers is through nutrition. Just like same thing with physical activities. Both those, like Dr. Lennery said, both those things interact and they play a really important role. And sometimes medication is needed too. So we want to create a habit change. So we don't want these short-term fixes. They obviously haven't worked in the past. So on this page, on page 4, if you have it open, you'll see someone who is not very excited about a diet, and that may be how you feel. And so I want you to think about yourself. You don't have to respond, but how do you feel when you're on a diet? You probably don't feel very good, and maybe bad experiences. And I keep on saying that word, but from now on, when I talk about, or when Pam talks about diet, we don't mean rules and regulations about what you can't eat. We're going to be talking about what you can eat, the smart choices that you can make that help to meet your health goals. We'll just call them health goals, because everybody on here tonight is not on here for the same reason. You're here for your own individualized things, whether you've been to a doctor and you need to manage your diabetes better. I keep on going back to that. But whatever it is, work on a number. And I'm so glad that you guys have the opportunity to get the meet up and get the lab values and get the testing done. You know, I don't know what word to call it, but that you guys will get to go throughout and kind of monitor that. And at the end of my little portion, I'll go over something else, but hold on one second. Okay, so remember, this is going to be a journey, and it's gonna take time. It's not gonna happen overnight, and it's not going to happen in just 1 month. And you guys are gonna be around for a while, hopefully, so we'll be in it together. And I want you guys to, I'll say this again, but I don't want you guys to feel discouraged anytime throughout this program when you may notice that your numbers go up instead of going down, or go down instead of going up, depending on what you're looking at. I want you guys to know that it's normal. Just like with any journey, any vacation you've ever been on, it's probably not been 100% perfect. There's probably been some hiccup, something that happened. And I want you guys to think of it like that. And so it's this up and down, but with perseverance, that you guys can really and truly change your habits. And that's what we're focusing on. Okay, moving over to page 5. You'll see this guy, he's thinking, and it says 1 equals 3,500. So you're probably like, well, what does that mean? So this means 1 pound, so think of a pound, equals 3,500 calories, which means if you cut 3,500 calories out of what you usually eat, So typical American, just to give you an idea, eats about 2,000 calories a day, so more than what a typical American does. Then you can expect to lose 1 pound, which you may be like, dang, okay, I just don't need to eat anything. No, we don't want that, because that can actually make it worse for us. This is why people go crazy counting calories, and maybe this is good news for you, but we won't be doing that throughout this program. We will not be counting calories. You can personally count it if you really want, but honestly, even me, myself, being a dietitian, it's just more focusing on the food and what you should, or what is good to eat, not should be eating, but watching your portion sizes and those sorts of things. And we'll get more into that. So a lot of people go crazy counting calories. They want to consume very few calories as possible, so the pounds fall off really fast. But that just sounds like another diet, right? So a lot of times these people who do this, they said people who want to go through, I'm losing my train of thought, but when people get so caught up in losing calories and not eating any food, what typically happens is you experience hunger, you get grumpier, you get sleepier, and it's just miserable. And then all that losing of weight to just go back to what you were, it's kind of a vicious cycle. So what we're going to be focusing on is how you can eat enough food to lose weight. So that's the big question asked, and it sounds a little bit odd, but what I want you guys to do, if you have a pen or pencil, because I'm trying to keep you guys on track and so that I don't lose your interest, I want you guys to write, am I eating enough to lose weight on that blank spot? So, and it's actually, if you didn't catch that, it's actually just the name of the curriculum. So, or are you eating enough to lose weight, or am I eating enough to lose weight? So are you eating enough to lose weight? Now, so got a couple people, their heads down. Okay, so you've probably got it written down now. And now you may be kind of thinking about that, because honestly, when I first read that, I was just like, are you eating enough to lose weight? And then it took me a couple of times, I was like, dang, that is kind of odd sounding, isn't it? And so it does kind of come off as striking or odd, because typically people think, I don't need to eat any food and I'll lose weight. But you can actually decrease calories and while also losing weight. You can actually decrease calories, your calories, while eating more food than you are eating right now. So it's just finding those foods that can benefit or help your body more. So that sounds really odd, but that's what we're going to be going throughout this this curriculum, or whatever, this program, if you want to call it that. Okay, I have one more thing to go over, and then I'm going to switch over to Pam. Now, if you guys will, can you turn your pages to page 11? And you will see a colorful graph or chart, if you want to call it. And it's tips for weighing accurately. And an important aspect, if you are wanting to lose weight, and I feel like it's still maybe not losing weight necessarily, but just helping yourself, I guess you could say, so is to track it. And I know you guys you've already met up and done your first rounds of getting your, I think you guys took weight and everything. I can't remember exactly all the things they took, but they got that. But it's also good to have your own at home to keep track of. But I will preference that with, please do not get caught up in the numbers. Do not weigh yourself every day. Do not check your waist circumference every day. I would recommend maybe once a week, but just do it for yourself. That once a week time, maybe you can print out a cool little chart, or just get a colorful piece of paper, put it somewhere in your room or somewhere in your house where you feel like you can see it. And then that'll remind you that you need to do this once a week or whatever, just to track it. And so what it is we have two measurements we can keep track of. And one is the BMI, and that stands for body mass index. And you guys may be pretty familiar with that. That's really what a lot of doctors use in their office, or healthcare providers, to get an idea of where you are at with your health. And they mark it by underweight, normal, overweight, obese, extremely obese. This is a great general tool, but it is not perfect. Let's just say that. But it's a good idea to know where you're at health-wise. And so how this works is it's your weight in relation to your height. You take your height and think of how tall you are, okay? And so you find it on this chart. And then you find your weight on the left-hand column on the side, and you just break it down and you look for what color you fall in, essentially. And so ideally we want to be in that normal range, but of course there's definitely some exceptions to that. So, but that's a good general one. So that's why I give that one's on there. But there's another one.
Did somebody have a question? Jamie, it might have been you. Let me unmute you. I'm sorry if I could.
Oh, you're fine. Did you ask a question?
Oh, I think you're muted, Jamie. If you'll hit the your unmute button. Oh. Kayla, you might go ahead and Jamie, once we get you unmuted, we'll pull you up.
And you can type it in if you have.
Okay. The height range start at 5 feet. I'm only 4'11", so how would I measure myself and my BMI? Because you
That's
guys
a good question.
I'll try to find one
She's
online.
just below 5 foot.
I'll try to find the online calculator maybe.
Okay, we'll find you something, Jamie. Okay, so that's a good question. Yeah, so this doesn't, of course, include all of them. But so there's a BMI that you can keep track of. But remember, don't go too crazy with the numbers and track it every day. There's also something called a waist circumference. And this is not in your book, but if you would like, I actually made notes. You can't really see it that well, but I made my note up here. And it's just a waist circumference measurement. So the circumference around something, and that's your waist. And I'll do a little demonstration. It's not going to be beautiful, but I just wanted to show you guys what the waist circumference is. More sensitive measurement of relative disease. So it gives you a better idea. I would say a little bit more than BMI because it measures. It looks at your abdomen or your gut, your belly. And so what you'll do, and you can stand up if you want to take a little, physical activity break and whatever, if you want to, so you can be familiar with it yourself. You could, and I can send resources to you, but you could always look it up online. But what you do, or you could do it sitting down, is you find your hips. When you're feeling for your hips, you feel for the top of them. Once you find the top of one, you're going to take a tape measure. So something like if you have a sewing kit or something or whatever. And then you're going to put it on the top of your hip. And I know you guys can't really see that. How about I scoot back some? And you're going to wrap it around your waist horizontally. And you're going to come all the way around. Okay? You're going to bring it back to the front. Pretty self-explanatory. And once you get that measurement, write it down. And that's a good starting point for you for the beginning of this program. And what you can do is each week, you can slowly watch that number and remember, there might be fluctuations. You may feel like you gained an inch and you're like devastated, but don't take numbers so seriously when we're going through this program, because it's a slow process. It's not a quick fix, but it is definitely possible. Otherwise, this wouldn't even exist. This program would not exist. So there is the BMI that you can keep track of about once a week, and the waist circumference. If you're not for sure how I do the waist circumference, if you're Google savvy or some way I can provide a resource to Anthony to provide you guys, then I can share that with you guys. But it's just wrapping around your waist and keeping track. But let me make sure I got through my points before I transition into Pam. So I think that's good. If you guys have any questions or anything that I have covered, you can put them in the chat or get them at the end. How about that? And we'll go ahead and transition to Pam.
Mute. And then, okay. So can you hear me all right? Everybody good? Okay. All right. So welcome everybody. I know if you feel like you might need to just take a stretch break, just feel free to do that as well. We're so delighted to see everybody. And for those of you that we got to meet in person, some of y'all we didn't get to see, but we did help Anthony with the food drop last week. And it was really fun to see faces. You know, I think I've been expecting this for a while, and I am used to doing education in person. So this is just a big challenge for me when I don't get to reach out, not necessarily that I would want to have to touch, but I'm very tactile with all of my food demonstrations or my food models. And so I hope we can translate this. I love the way that Dr. Lund said that he's a translator. Hopefully we can translate the information that we want to share so that it's meaningful and that it's going to make sense until we can get back into a face-to-face education opportunity. So thank you so much, Taylor, for the laying that groundwork. Couple of points I want to just kind of echo with her. If we can take the word diet, if we would put it on a big piece of paper and then just tear it up, right? Throw it away. Because if that is a framework that we're always going to be hindered by, it's going to be difficult for us to either change the way we do something or even have an opportunity to learn something new. So what I'd really like you to think about is, it's not about thinking of what a diet is. What I found out as a dietitian is, and I don't know if you can see all these cards, but each one of these red cards has a name on it. And this represents all of the vitamins that we have identified, we, scientists, research, that human nutrition is essential. So every time I look at food, I try not to say, oh, is this good or bad for me? I try to find out, how many vitamins am I going to get when I choose that food? And is that something that's going to benefit my body, or is it going to harm it? And I think sometimes when we even frame foods as good or bad, how does that make you feel? Do you want to be the person that says, ooh, I eat bad food all the time? For me personally, that doesn't make me feel great about myself. I almost kind of end up shaming myself that I did something bad. But if I say that I ate something that is going to make me feel better and it's going to help my body to be well, then that's even more of a motivation. So those were vitamins. Look at all the minerals. And I apologize, you can't see the actual words, but trust me, there's about 50 vitamins and minerals that your body needs every day for nutrition. And so if we can start to frame our conversations about our food choices versus it's good or bad for me, or it's not on my diet, how about if we start to say, hey, is this something that's going to give my body what I'm needing as far as the nutrition that's going to give me more energy? Show of hands, anybody want more energy in their life? Yay. Oh, that was a bunch of thumbs up. That's awesome. How about if I have a sense of clarity? I don't know, anybody starting to have a little challenge with their thinking process? Yeah, I see that big hand. All right. So the things that I think we focus on when we go see our primary care is, you know, my weight, my blood pressure, my blood sugar. I want you to be thoughtful of those. And we've already done some screening and we'll continue to look at that progress for you. But I also want you to think about the things that you're maybe not getting asked about. Like, how many of you have a challenge sleeping? Do you get a restful night's sleep every night? And for those of us that might be in that menopause, you know, boat, whoo, Lordy. So let's think about, how can I have a better sleep at night? How can I have more energy during the day? And how can I have clarity with my choices so that I'm really not struggling every time I'm in a fog? And maybe those are the things that you can be tracking as well as the things that Taylor mentioned with your weight, your BMI, your waist circumference. Those are what we call metrics, that we have a physical way to do that. But some of the intangibles, like on a scale of 1 to 10, how am I sleeping now? A 3. Hopefully by the end of the program, you're going to hit a big fat 10 and have the best dreams ever. So along this journey, which I love the way she framed that, journey to me says I'm going to go with somebody. I don't ever want to journey by myself. And I also know that I'm going to have support along the way. So those are the things that we want to provide for you on this journey. So my part is, I want to talk just real briefly about fiber. And I have these little fun cards today too. My fiber card. I think we had a couple of questions about, you know, what's a good diet for high cholesterol, and we'll try not to say diet again, but what's a good strategy? What's a dietary strategy to help address cholesterol? The reason why you got that first recipe for chili was one of the ingredients beans, can of beans. Yep, 2 cans. Whoop, sweet, 3. Bingo. Oh, y'all were just like going, yeah. So beans are one of nature's way of helping our bodies to regulate its cholesterol level. You already started your journey to help your cholesterol if you ate that meal with 3 cans of beans in it. Okay, so that's one way for us. It's not a medication, but we know that food can be medicine to us when we've got the understanding of how it helps our bodies to be in a positive state versus a negative state, or benefit versus harm. Okay, so going back to your participant guide, would you guys turn to page 6 for me? And what's really nice about this participant guide is you guys can read it at your own leisure after we have our, classroom episodes with you, or sessions with you. So feel free that you don't have to read everything right now, but what I want you to see on that 24-hour natural fiber rich food inventory, those are the foods that I'd like you to start understanding, that when I'm asking myself, where are 50 nutrients going to come from for my vitamins and minerals, you're going to find the majority of them in those 24-hour natural fiber rich food inventory. Okay. Fiber is one of the best strategies that your body benefits from when you eat fiber on a regular basis, to help cholesterol management, to help blood sugar management, and your weight management. You get 3 huge impacts on chronic disease states that we talked about with Dr. Lynn in the very beginning of our session. And these foods right here are going to take you on such a great part of your journey. It's going to be fun versus I'm going to feel like I'm struggling because it's a diet. So what you can do, we don't have a whole lot of extra time for right now, but what I'd like you to take time, maybe as a part of your homework. Is everybody okay if we have homework? Just a little? Okay, thanks. We're going to do, what I'd like you to do is circle the foods on that 24-hour recall list that you are already eating. Okay. And you may feel like, well, and you don't have to share. It's not like, oh my gosh, I'm doing great, I'm doing bad. It's just what we call a benchmark. It's a place that, or baseline. Where am I starting? So if I find out that on my sheet, I've got 3 circled, we have some improvement that we can work towards. If you've got 23 circled, you can teach the class. Okay. So my favorite part is there's not a right or wrong answer. And I love that Taylor, set the groundwork for that. We're not here to have the right answer necessarily, or the wrong answer. We're here to have optimal outcomes for each and every one of you. And I know that word normal, I'd have to be not in that group. I'm probably not normal, but I hope that I'm going to achieve optimal outcomes that I personally, through my genetics, through my lifestyle behaviors, and through my dietary choices, can achieve. So each one of you, regardless of what that looks like, should be able to say, I improved. Not that I'm normal now, if I was in an unnormal range, but am I in an optimal range for my health benefits, or health outcomes, excuse me. Okay, so I want you guys to do that for homework. And then the next page over on page 7, it's just giving you categories. Again, this is going to be kind of a lot of food lists, if you will. And this just helps people to say, like, if I eat a fruit, what would that look like? If I eat vegetables, what do those look like? Beans, whole grains, nuts, and seeds. Those are typically the 5 categories that we associate with the highest amount of fiber content. And I'm not talking about Metamucil or something that you would mix in water and take as a supplement. This is nature's way of giving you those that ingredient that's going to help your cholesterol, blood sugar, and weight management. Okay. All righty. One last thing for me, just to be thoughtful of. I was driving in today to work, and I looked up and I saw a rainbow in the clouds, and I knew today was going to be awesome. So I want you to be thoughtful of, how is each day going to be something that you look forward to? I don't want this homework to be overwhelming, but I want you to really start thinking internally, look inside and say, what is it that I want to get out of this program? Taylor mentioned, if it's weight loss, congratulations. I'm real hopeful that that will be something that you achieve. But my bigger hope for you is that you're going to come away from this program confident, feeling much more energized, much more focused on what it is that you're going to do. So this journey is going to be a place that you end up where you really want to be. So those are my kind of closing thoughts for that. Okay.
Yeah, real quickly, I just want to take a couple moments to introduce you to a couple more folks before we get out of here. One thing to note is we're going to try to give you guys as much notice as possible as to what we're thinking of for the length of the class, and so just know that we're gonna try to be mindful of that. And so just know that's why we're going to really ask that if you could be on as promptly as you can to 5:30. That way we can try to respect you in that way. But real quickly, I want to introduce you to two folks before we get out of here. One is Valerie McMurray. Valerie, I see you're here on the call. Valerie is going to be talking with us in future sessions about fitness. And so, Valerie, if you could take just a couple minutes and introduce yourself to the group, that would be fantastic.
Good evening, everyone. Good evening. Okay, well, the other piece of that puzzle with eating right, the next one is exercising, because our body is a machine and it is made to move. So can you imagine what happens with a car? You can buy a brand new Mercedes, you can buy a brand new Lamborghini, or you can buy a hoopty. If you let it sit out there without moving and without being used, it is no good. So that's also relates to our body. So our body is a machine. So also we have to be careful about what we put into our body, because we are what we eat. We are what we think. So I just want to say that I'm really excited, because one of the things that is very important to know is that through exercising, most diseases, any type of diseases, most of the time can be controlled through your exercising and the way that we eat. So that's amazing. So that means that you get an opportunity to control this. So we're gonna spend some time throughout the rest of the week just learning to do some exercise, healthy breathing. Breathing and exercise, it detox your body. So get all that nasty gook out. And if you're like me, you're dealing with sinus and allergy issues right now. So correct breathing and getting some of this out of our bodies and get a chance to move around. It makes us happier. It makes us feel good. These bones that we have, we're going to start being able to reach all over our heads and all to the side, to the left side, to the right side. And you get an opportunity to join our classes with online with Metro Tech for free if you like. Right now we have a hip hop ab class, 15-minute ab class. We have a yoga class. We have a kickboxing class, and you get an opportunity to come if you like. So you not only get a chance to get me, and I'm the director for community outreach and wellness, but you get an opportunity to experience our instructors if you like. So I look forward to spending more time with you. And although I know he saved the best for last, but he sure did here. But
Yeah.
have a wonderful evening, and I look forward to us spending more time together.
Yeah, well, thank you so much, Valerie. One more person I want you guys to meet this evening is also a great friend and advocate of this program. This is Miss Leandra Moore. Leandra is going to be talking to us about some things that relate to mental health and this concept that we have called hope. And so, Leandra, if you could take just a couple moments similar to Val and introduce yourself, that would be great.
Absolutely. And of course, I am definitely the best for last. Valerie is next to last. And yes, I'm excited because I get to really be the glue to all of this, because we know we don't have motivation to address our health, exercise, if we don't take care of our mental health. I have a campaign called A Checkup from the Neck Up. We know we can't do any of that stuff. We don't take care of our diabetes. We don't have the motivation to follow any of these plans if we really don't take care of our mental health. I get to be your hope navigator through this 12-week experience. And I'm just going to leave you with what I got. The most important thing is understanding what hope is. And hope is the belief that your future will be better than today. And you, as a member of this wonderful trip on the road to health, have the power to make it so. And together, we'll get to really take this journey together. And we'll get into what your checkup from the neck up is. You have me as the director of behavioral health services for community health and my team, but me personally to help you in this navigation. We'll talk about setting some goals while we're doing this work, what your personal goals are and where we're headed to in this 12 weeks and where you want to be for yourself. And I'm excited to do this journey with you. And so I'll be here every single week to cheer you on and to meet with you independently. I'm excited. I have the energy and I have the belief in you. And I have the belief that you alone have the power to make the hugest difference in your life. So welcome and congratulations. Awesome.
Yes. Ladies, I really want to tell you as we're close this class, you guys have the luxury in this program to really have access to some of the brightest people in their fields, who are doing this because they care about the community. They care about the effects that they can have in people's lives. So I would strongly implore you to be engaged, to put 5:30 on Tuesday on your calendar, and respect it, and to be here and to be engaged, because I'm telling you, I know every single one of these instructors personally, and they care about their work, and they really do want to see a positive change in your life. So we're getting off, as we're exiting, a couple of things to note. Like I said, put it on your calendar. Next week, 5:30, we're going to be here, right? I'm still going to call you 100 times to remind you. Tomorrow, 3 o'clock, meet me at MetroTech at the STEM building, that little drive-through. Meet me there tomorrow. I'll be there for the same thing. I really do appreciate every single one of you for taking time out of your busy lives to be on with us. We really want to engage with you. We really want to see positive change. And so I thank every single one of you. Taylor, Pam, Leandra, Valerie, and those that were on with us that aren't anymore, Dr. Lynn and Brianna, and the rest of the teams that we're working with. I'm so appreciative of them as well as you all. So thank you guys so much. Let me know how I can help you and serve you in this program. But I look forward to seeing you guys next week, and know that you're going to hear from me over the next few days, right? All right. God bless. You guys have a good evening.
All right. Good night.